Hello, dear viewers. So this morning we shine a spotlight on one of the most common yet often misunderstood areas of health, which is joint pain, autoimmune disorders, and the growing challenges related to rheumatic diseases. So to help us better understand these conditions, their early signs, and the latest advancements in treatment, we are joined by the leading expert in the field. The two leaders in our pleasure to welcome Dr. Aqeel Abdullah, rheumatology consultant and physician in the general medicine, who will guide us through key topics such as the early diagnosis, lifestyle factors, and how patients can better manage their symptoms. And hello and welcome to our show. How are you, Doctor?
Thank you very much. Pleasure to be here.
So talk to us or give us a few steps, or as they say, first steps, and what is rheumatism in general, and how are the factors that actually get into this?
Gotcha. So rheumatism is a term that is used here in our country mostly for people who have arthritis or joint pain due to autoimmune diseases rather than injury where orthopedic surgeons step in. So this is basically what it is. So usually patients who have rheumatism or rheumatoid arthritis are usually people who are considered relatively young and do have pain on a daily basis in multiple joints in their body associated with stiffness and sometimes interference with their daily activity.
So a lot of people actually confuse between joint pain and rheumatism. So is there actually a big difference between them?
Well, joint pain is more broad. Joint pain can happen to everybody. For example, common causes of joint pain is overuse, injuries, these type of pain that can happen to everybody, young and older. But rheumatoid, it's actually a specific disease that starts at a specific time in life, and it affects probably 1 to 2% only of the general population.
Oh, okay. So what are the most common rheumatic conditions here actually in Kuwait? And does the, let's say, the season that we have here, which is mostly summer, affect it?
Yeah. Well, the most common autoimmune disease is rheumatoid arthritis, which causes polyarticular pain, which means joint pain in multiple joints, mostly in the hands and wrist and feet. The other one that is considered relatively common, it's arthritis secondary to psoriasis, which is a skin condition, which we call it psoriatic arthritis. This is considered to be relatively common. Other common disease, something called ankylosing spondylitis, and this usually affects very young people, meaning teenagers and early 20s. And this one affects their spine more than their peripheral joints. Also lupus or systemic lupus erythematosus is one of the also complex autoimmune diseases that is considered to be on the top of the 4 autoimmune diseases. Now there's one more disease that it's not autoimmune, that is very common, it's more common than all of those, which is called gout.
Gout, yes.
I've heard about it. Yeah, so this one is mostly metabolic. Metabolic diseases is in the same category of diabetes, hypertension, and those. But they cause joint problem more than the other ones.
And usually what is the link between the weather and all of these diseases that you're talking about?
So 2 things that people think, or people who have the diseases always complain that change in the climate can make their symptoms worse, and that is true. For example, cold climate and the humidity are probably the most common changes in weather that can make people who have arthritis suffer or feel it more. And even with the people who don't have the diseases, they feel that when it's humid or it's cold, they feel that their joints are stiff and painful. So if we come to cold weather, it's really more related to physics. You know, objects shrink in cold atmosphere. So the joints will shrink as well because they're very superficial structures.
So it's kind of like the scientific experiment that we do in high school, where
Exactly.
about the metal, where it actually becomes flexible in summer,
Exactly.
and expands, and then in winter it actually shrinks.
True. So the joints which are the most superficial ones, they're ones that are affected when the weather gets really very cold. And that's why they feel stiff, and they feel that they have to warm themselves before they start moving. When we come to humidity, humidity also has to do with physics. It has to do with a change in the barometric pressure. So there will be a drop in pressure, and that will make the joints expand a bit and will stretch the nerves and make the people feel pain. So the thing with that is people try to, get in areas where there's no humidity indoors when it's very humid.
But is it correct to actually, every time when the weather changes, is it correct that we always have to keep sure that our knees are intact and our elbows are intact, that by staying at home, or just let the weather just,
well, it's not dangerous. It's really not dangerous.
Okay.
The problem with it is uncomfortable.
Yeah.
And most of the time, the body will adapt. So during the time of adaptation is a little bit uncomfortable. But we don't want to
But it's natural, and it's okay.
It is, yeah.
Even if it's a little bit of pain.
Yes.
But it's okay to just let your body adapt. Because that is basically, as they say, human nature.
Exactly.
So there's no point of actually taking painkillers
unless if needed. We don't want people to suffer. Some people have pain threshold change or different from people and to people. Some people really can't tolerate a lot of pain without taking any medication. Some people, if they don't take the pain medication, their day is not going to be the best. So maybe those can take simple analgesia, the ones that are very safe over the counter, just to make them go on.
So we have autoimmune diseases such as rheumatoid arthritis and lupus. They're becoming more these days. How come? Why is it so common?
I don't think they are getting common. Once the population increases, the number will increase maybe. That's one factor. But I think because the awareness is increasing, and this is one of it, these programs will alert people to seek medical attention. And I think the Rheumatology Society, specifically in Kuwait, they're very active in terms of education and awareness through media. So I think this is one of the things that helped us to be able to get a lot of those patients. Unfortunately, they were missed in the society. They were not diagnosed earlier before. The other thing that helped as well is the increasing number of rheumatologists in Kuwait now. So if you go 10 years ago, you're going to see that number almost doubled.
Yeah.
And this increase of number means more patients can reach doctors and get the proper diagnosis. So I think this is probably what's the main reason behind that.
And the reason that our life right now, it's it is actually busy. And with hustle and bustle, we tend to not feel what we're going through. Our body's disconnected from our head. That's also a reason, right?
This is one of the reasons, because patients who have arthritis, usually when they start to move and they start to get active, not only because they get distracted from the pain, but actually the pain decreases because their movement means circulation of the fluid in the joints, which has the inflammatory cells. So when they start their day, they're very stiff and tired, but once they start to man up and start to get through the day, they will start to they feel it goes away. So they always will relate that to the way they were sleeping. Maybe the air condition was too cold, maybe the pillow was not right, and they start to change their pillows and try to adjust the temperature until it's too much to handle.
All right. So let's talk about diagnosing the problem before it actually happens.
Okay.
Right now we have a lot of people that complain about their pain, but most of the time it's too late, or they come in too late.
Gotcha.
So we have to, prevention is better than medicine.
Exactly.
So how can we do that?
See, the way to prevent these diseases is we're not there yet in 2025.
Okay.
I don't know if there's going to be a vaccine for that in the future, but who knows. But the point about early diagnosis, that's really crucial. Why? Because patients who get diagnosed early has a better outcome, has better prognosis. Their disease will not be as bad, usually, and the management can be early to control their disease, meaning to get them a better quality of life. And those people probably have the chance of stopping treatment in the future if they got diagnosed and treated early. Although it's known as chronic disease, and a lot of people think that this disease might not go once they started, but that's not really true. Some studies show that if you diagnose them very early, within few months, and you start treatment early, you really have a chance to stop treatment in the near future.
Modern tools and tests. When
Yes.
you hear those two words, what comes to mind?
Yes. So laboratory tests now are getting more advanced in terms of finding more specific and sensitive antibodies that we test that we didn't have them a while ago. But what really changed over the last decade in rheumatology is using the tools of imaging. So ultrasound is a machine that we all know that. It's been there since many years. But the introduction in the field of rheumatology is not very old. So now most of the rheumatologists use it because it shows you what's under the skin.
Okay.
So that will help you to detect better. The other thing that MRI is one of the type of the images that has been used now more often in diagnosis of rheumatic diseases, more than diagnosing disc prolapse and mechanical problems that our colleagues in orthopedic surgery see, but also we start to understand these tools, how to use them now. So imaging and laboratory tests now are very helpful to reach earlier diagnosis.
Now, when we talk about lifestyle, as you said, like getting up in the morning, manning up, and just moving. So how can we actually tell people, advise them that changing lifestyle is very important and it will actually decrease the problem of rheumatism or any other disease that's related to it?
That's an excellent question. A lot of people think once they start to have arthritis, exercise might harm their joints. Actually, it's the opposite. Okay, so those people will notice, they'll tell you, once we go to the gym, we have no symptoms at all. That's very unusual. Once we're outside the gym, we start to get the pain more. We like to spend all the day in the gym for that. Okay. So once they go to the gym, what they're doing really, the movement of the joints will do many things to the joint. Number one, it will circulate the fluid that has the cells that cause the pain. That's number one. Number two, it will make the bone stronger. The bone, as it looks, it's a very solid and organ. It's very, what we can call it, it's a very lively organ. It's solid, but it has a lot of blood flow to it. And it's very important to regenerate all the time, and the exercise will help that. Not only that, the ligaments and the tendons around the joint is going to get stronger and more endurant for those patients. So that's number one. So exercise is very important. Of course, we don't advise for the exercise that can cause injuries.
Like extensive exercises.
Exactly, and, like fighting or something like that. The other thing, one of the very important lifestyle modification is smoking. Okay. So smoking is very strongly linked to the development of the disease and interfering with treatment. Some of the treatment don't work very well when the person smokes. Okay. So it will make the drug or the treatment.
So it's kind of like blockers.
Exactly.
Okay.
So this is one of the things that people have to understand, and I'm seeing that smoking getting very popular.
And what about food in general? Does food actually affect? Do we have to have a good lifestyle of also dieting? And is there specific food that actually pushes to inflammatory?
Well, this one is not very consistent among studies. However, some of our patients tells us that when they eat this type of food, their joints get worse. And that's what we really advise them to do is try to decrease the amount or avoid it if it does. Okay. But the good news is that there's some treatment actually which is good for the body and makes the inflammation less. Yeah. For example, curcumin, turmeric. Okay. There's now officially studies on it. Showing that it works like an anti-inflammatory treatment for patients who have a disease. And we do have some patients in our clinic who refuses to take chemical medications, and they ask us how to improve our life by doing something natural. So we advise them to start to take high doses of turmeric and exercise. Okay. And all of them get away with it.
So in a sense, they also should do tests on their bodies to know if they actually have, like, let's say, a negative reaction to specific kind of foods that actually could involve inflammatory. Yes,
that will come. We don't ask them to go testing because these tests are not very accurate. But I think the best test is experience. So they will tell you that when I eat a lot of cheese, for example, I start to get joint pain. We'll tell them, you know, next time, eat less and see what happens. And if they're still there, try to tell them not to eat it for a while and see what's going to happen. So try to choose some of the people, some type of food is not good for them. but it's really hard to find out that until they try it.
Very true.
Yeah.
Thank you so much for being here, Dr. Aqeel.
My pleasure.
And we hope to actually see you soon and be invited right back here again. And good morning.
It's always my pleasure to be back.
Thank
you very much for inviting me.
everything that you've gave us, and it was very informative.
Thank you.
I hope to see you soon. Thank you.
Thank you. Have a good day.
All right, all thanks and appreciation to our guest, Dr. Aqeel Abdullah Mhanna, rheumatology consultant and physician in the general medicine. All right, dear viewers, how about we go take a break, and we'll be right back right here at Good Morning Kuwait.